So we will go ahead and get started with our discussion.
Hi, everyone. My name is Jose. I work for the local water district here in Oakland. Um, I think the response in my workplace has been similar to what's been happening in other workplaces. Um, the measures that have been taken so far really haven't been adequate in addressing the mounting health crisis. Some steps have been taken, such as implementing telecommuting or work rotation programs to reduce the number of people that are working at the same time. Um, but which makes but I think there are still a lot of people that are showing up to work, mainly because we're considered essential workers, which makes sense because water is an essential utility that people need. But I don't think people should have to risk their health and safety in the process of providing these critical services. At my workplace, there's been a lack of urgency from the district in really identifying who really needs to be there and who doesn't. And so there are still people that are coming in that really shouldn't be there, and they're just exposing themselves and others to the possibility of infection. We actually had our first case last week, well, which you would think would be a wake-up call, but instead of sending people home, the district is proposing to bring people back from retirement now, so they can help with the workload, which really undermines our efforts in really tackling this crisis. Um, a lot of people at work feel this way. I've been reaching out to a number of people that I'm connected with. Um, and the general sentiment is that they don't feel safe being there. They're only showing up because they don't want to fall behind on their workload, or they fear retaliation from management. Um, and so, and some of them, like janitors and field crews, aren't really being provided with the proper PPE yet, which they spoke about at our last board meeting. Our unions have been trying to negotiate some demands from the district, like getting the proper PPE and also getting paid admin leave for non-essential workers. But that's been going on for over 2 weeks, and from talking from union officials, it seems like the district is still reluctant to concede some of those demands. And so the response really has been a failure at all levels, from the White House to our workplaces. And that really needs to change if we really want to have a fighting chance against this virus, or at least to minimize the impacts. Because as we know, the worst is still yet to come. So.
Thank you. I want to thank both speakers. I think that it was really useful to hear both of the perspectives. Yours, Garrett, on what are the rights given to us by the state, technically, although not necessarily substantially, and Dipti, your experience altogether resonates a lot with me. I'm also a healthcare worker. I work at 2 different healthcare facilities, and what I have seen is everything that Dipti has said. I'm also not in direct care for any COVID patients, but what I have seen and experienced is this idea that, you know, our bosses or management or administration has basically lied to us in so many different ways by saying it's okay for you to come in without protection. It's okay if you don't have to, because if you're not dealing with a COVID patient, or you're safe to use this kind of equipment, when in reality, the truth from the beginning was always that there wasn't enough, and they were willing to admit that and to respond to that the way that they should have, which was to drastically convert any type of industry that could have produced this so highly needed PPE. And I think that one of the things that I have done with my coworkers, which I think has helped a lot, which is what Garrett was mentioning, was to attempt to have some development of collectivity, because I think everybody's really scared right now, scared of what the virus means, but also scared of losing your job, just like you see a lot of people. And so to come up against management and say, I don't want to do this, is scary. And it also goes against what, even as healthcare workers, we don't want to not be there for our patient, but we are stuck in this. The only way that I have found that has helped me has been to bring my coworkers together. And the way that I did that, creating what I like to call Corona with Lime happy hour. And so we get together and we just talk about all the stuff that's going on at work. And immediately, of course, it was supposed to be a distraction from everything that's going on, but it immediately turned into, of course, talking about difficulties that we're facing and how to confront it. And that has given us a lot of relief, and also helped us in a way to figure out how we want to do things together. So I highly recommend trying that.
Hi there. I'm me. And I just want to say that when we say things like administration, bosses, union, these things, these are units of human beings. And I want names. I want names published of people who are firing people. I want names published of people who are lying to people. I want those of us who are gathering, tangible, useful, proper information to, like you have spoken, all of you, of collectively, talking to this other human being about their accountability and the effects of what they're doing to themselves. And for people who are, we talk about grassroots movements and how these things, people who are in the trenches, which I am not now, but have been, we need to go to those people who are so-called a step above us in this false hierarchy and say, your behavior is not okay. This is not about money. This is about people's lives. This is life and death. And if you're not going to be a part of making sure people are getting what they need and people are getting the protections, then your name's going on this list, and everybody's going to know this is the decision that you made and how you are treating people. Thank you.
I work for Big Pharma, and normally that makes me cringe. However, at this point, I'm stunned at how they're supporting us. And I'm immunocompromised with asthma, and so we've been given off till May and maybe further. At the same time, I have friends in Kaiser Hospital who are coming home after a long shift, and they're making their own masks for the next day. And this is America. What the hell is going on? And why are we're continuing to send supplies outside of the country? And we need to stop this. We need to find a way to stop this and bring these supplies back. I'm not going to take much time because I know you have a lot of people. So thank you.
My name is Anthony from Newark, New Jersey, and I live with my aunt, who's a frontline worker. She actually is at one of the hospital, or the second hospital that has the most COVID cases, and she's really, really, really concerned. And her worry has grown, especially when it comes to supplies and resources. And then in Newark itself, you have the administration has worked together with the surrounding mayors to put the cities of Newark, Orange, East Orange, and Irvington in a special lockdown. And so fortunately, we have a lot of lawyers that we're working with to kind of figure this out, and like, how are you superseding what the governor is doing? And what has bothered me is that we see that, okay, yes, we're overpopulated, but if you're looking at the deaths in New Jersey, a lot of them come from the suburbs. So why aren't they in a special lockdown? Why is this only happening in the poor and Black communities? And so there's been a lot of pushback from a lot of different people, and people are finding it very, very hard to organize because you can't do the face-to-face contact. And then some people don't like the Zoom meetings and things like that. But I tell people, it's like, we have to keep this level of accountability going, and that things, you always have to have a plan. And this is the time where like groups like, Speak Out can definitely help other people. And that's what I try to point them to. Like, there is hope here, but I think people need to find it or need to realize that it's out there in order for them to really become a part of something.
Hi, my name's Lisa. I'm a clinical lab scientist and I work at UC Berkeley in the Student Health Center. And at this point, I'm really missing just doing a normal urinalysis because they've tasked me with helping a couple of research labs in the university to become testing facilities. I've been basically working about 2 weeks straight every day, at least 10 to 12-hour days, if not longer. Sometimes it's from 4 a.m. until the time I go to bed at 9:30. So we're doing everything we can, trying to source materials. Just the actual collection tubes has been a monumental task. Finding gloves, N95 masks, and all the other things that you're saying. And to be honest, yes, we are hoarding the Thermo Fisher kits because we know that we're going to need them in the future. And so we don't want to be like Quest and be, last I heard it was 27,000 tests that they're backlogged, and we want to have a better turnaround time. But those shortages are just killing us. I guess what I really wanted to go into and what one of the biggest issues with building out these labs, not only the shortages and the shortages of CLSs, so clinical labs have to be manned by people who are licensed CLSs, and we're a real rare commodity because there is no education system for CLSs. The labs that they get, hospital labs, have shut down the programs. So the education system, because it's for profit and these hospitals for profit, and education costs the hospitals money, they don't want to train people to do this work. So we're short of people to do the work. The other thing that we're running into a money issue with is if we had a single payer system and a single Medicare system, everybody would have a number. We would just plug into the system and be able to report testing. But we're rebuilding everything from scratch, including a way to report to physicians. So just one other piece that has been problematic that people aren't thinking about.
Hello. Just Matt for now, but thanks so much to the speakers and organizers. I think regarding health workers, Dr. Dipti said it best: we're being heralded as healers while being asked to die as martyrs. And so my name's Matt. I live in Redwood City. I'm about to graduate from medical school in May. I signed up for the California Health Corps because Gavin Newsom is asking for medical students to volunteer. So I'm on their list. My partner also works in Santa Clara in healthcare on the front lines, and I've been having insomnia all last week. But on the bright side, I'm going to get a puppy tomorrow, and I've been trying to read books, log off of social media, and write in a journal with pen and paper. Another medical student and myself created a group called Doctors for Bernie, and it's an independent group of about 800 doctors and health workers so far. And we're planning to release a statement on COVID-19 on Monday. And we're struggling with continuing the electoral fight to elect Bernie while planning for the likely scenario that he will not win the Democratic nomination. And so that likely will fall into the realm of organizing workers to build solidarity and autonomy among our members and their coworkers. And in the meantime, I'm personally calling my representatives in Congress and telling them to publicly call for Joe Biden to drop out. Thanks so much. I appreciate you all.
Thank you. So I was asked to speak about the current situation in Louisiana, New Orleans in particular. So as of this afternoon, the state, we have over 12,000 positive cases, 409 deaths, so making us a current hotspot for this epidemic. The people in New Orleans, they're especially vulnerable because of the overwhelming numbers of individuals who have underlying conditions and also the large number of individuals living in poverty. To give you an idea of the current hospital capacity in New Orleans, 75% of our ICU beds are in use, 73% of our hospital beds are in use, and 54% of our ventilators are in use. On Friday, the state did release some modeling data
And the current trajectory is that by mid-May, we're going to be peaking at 2,500 hospitalizations per day. To put that in perspective, as of today, we have 1,700 patients who have COVID who are in the hospital, and 571 of those patients are on ventilators. So it's going to get much, much worse in New Orleans before it gets better. So I hope that hearing how bad it can be, it's a motivation for those in states that are not in hotspots to keep doing what you're doing. But also, you know, listening to all these politicians talk about how much more we can do to flatten the curve. They're saying that, you know, people need to listen to recommendations, stay at home. But I don't think there's a lot of people talking about what organizations and businesses can do to minimize the risk to the workers. So thank you to all the speakers and everyone sharing their story.
Yeah, I just wanted to say one comment about, you know, people were asking in the chat, I saw, you know, how could it be that they would, you know, punish these workers for bringing their own protective equipment, you know, and I think it reveals to us something that's happening in this moment is the biggest fear, I think, from those that run this society is that in this moment, people take stock of the fact that we've been abandoned and everything is up to us. And so what it is when people take matters into their own hands at their workplaces and trying to bring in protective equipment and so on, it is an act of complete and utter defiance. And so what it is it's them trying to stamp that out, because their biggest fear is that people come away from this realizing that what kind of world we live in, what kind of society we live in, and who is going to make those changes is no longer going to be, you know, in the ballot box waiting around every 4 years. It's going to be the fact that people are doing the work right now of moving the goods. People are treating us in the hospitals. Everything we do is depending on us. And there's a huge opportunity for people to realize that. And I think that is exactly what they're afraid of. And hopefully it's exactly what we're going to take away from this.
Thank you, Mark. I wanted to go ahead and see if Garrett and Dipti had anything to say.
Yeah, sure. This is Dipti. So I did want to, I think there have been a lot of comments around, well, it started with Jose speaking of, you know, essential workers, a water worker or a utility worker is an essential worker. And I think something that people who are asked to work should fight for and agitate for. And certainly as a healthcare worker, I'm trying to agitate for our essential workers. You know, the workplaces should provide the opportunity for workers to get tested so that you know whether your coworker or whether yourself, people should know who is infected and who isn't. And asymptomatic spread is a real thing, and we know that, and community spread is happening every moment. And and you know, those of us who do work right now, people aren't maintaining social distance, and a lot of these jobs can't be done apart, and you're breathing the same air, whether it's a warehouse, whether it's an office. And so I do think that, you know, if you are at a workplace where you are expected to show up, I'm sure you and your colleagues will see eye to eye on seeing if you can demand for getting, at the very least, tested, you know? And I think that would be, at least in the immediate few months that we have going forward, it would be real nice to know if the colleague right next to you is COVID positive or not.
Thanks. I just wanted to say that with a lot of these workplace conditions, which are obviously suboptimal, I think one route to do something about it in the midst of this is to really work on the media. You can see that even with the Navy's aircraft carrier. It was the fact that the San Francisco Chronicle printed the letter, you know, caused the whole shitstorm to start. So I think, for example, you know, the water worker at EB Mud, if there's been an acknowledged case of work, you know, of COVID there, that's something the Chronicle or one of the local news stations, I'm sure, would be interested in. If you're protected by a union and the union can talk about what they're proposing and have not succeeded in getting EB Mud to agree to, I think that's a newsworthy story, for example, and it might actually improve working conditions there. So I think other people that are in situations where even if you don't have a union or it's just you, that's worried about it, I would still try to get the word out to the local media, because I think in the current situation, they have a lot of juice.
Hello, this is Richard. And I just wanted to say a good news, bad news type scenario. Let's try to stay conscious of some good news. With so much industrial pollution and so much commuting and everything down, we have clear climate conditions in virtually every continent for this brief moment, which shows as far as things like global warming and healing the planet are definitely achievable if we all take this kind of mass concerted effort. So let's just remember, this is a test tube for many reasons, not just the COVID experiment, but many reasons we could try to reshape society. And I've also been considering May Day. This holiday of socialists is something that we can really take advantage of now that the whole planet is home. We need to think about memes and messages related to COVID, related to care for the people and the power of the people, while all these workers are sidelined. And that's all I really have to say, just that in my workplace, I've been sharing masks with my fellow frontline healthcare workers, homemade masks and masks that we've given as donations from the public. And we simply don't stand for the pushback from management. We put our masks on and we continue to work. We may be in a very lucky situation, but I think if enough people just create the mask as the folk way of America right now, we can get by with it. My heart goes out to those people that have been terminated or threatened by their workplace, but I'm just saying we went ahead and pushed back. That's all I have to say for now. Thank you to everyone in solidarity.
Yeah, hello, my name is Aiden. I'm a student at UC Berkeley, and I wanted to emphasize something that was mentioned in the presentations, which is that, what we're really seeing during this period is the complete collapse of the system and really laying bare how horrible it is in many respects and how incapable it is of providing for human need and guaranteeing our safety and our happiness and our health. And I think that it really does provide an opportunity to talk with people and expose how the system functions and show them that it doesn't have to be this way, that there is an alternative. So with that, I wanted to say that if there are any students in this town hall who are interested, I'm trying to start a student newsletter. So if they're interested in talking to me about that, I'll put my email in the chat. And yeah, now's the perfect time to talk to people.
Hi. Yeah, I wanted to say something also to echo that I think one of the big things that's going on right now, and I totally agree with and appreciate what the speaker said, is the exposure of capitalism, and it's definitely an opportunity and an opening to talk with people about that. But I think even further than that, and I saw someone posted in the chat about New Orleans and recognizing that people can help each other better than governments can. And I think something I realized as this whole thing was unfolding was that I knew so many people who were losing jobs and who were going to be at risk of not being able to pay their rent, and how that showed them just how precarious this system is, that all of their plans for the future have completely changed, and that there's no reason that they had to go through that experience or those problems alone. And that it makes sense right now. We started to meet regularly and just sort of collect the people around us, the friends and friends of friends and people in our communities who are being affected by this, to just start to share resources, to talk about how we can help each other out in these moments. And I think that's where the real opportunity is sort of showing people and helping people get organized in response to this on whatever level that we can. So thank you guys for speaking, and thanks for everybody participating in this discussion.
Okay, hey everybody.
Drew can't hear you.
How about now?
We can hear him.
Awesome.
All right, Drew, while you figure out your sound, we're going to move on to V.
No.
I'm here. Can you hear me?
No, we can hear him.
We can hear him.
We can hear him. Sorry, there's a glitch with my computer.
So, all right.
Go ahead.
Sorry.
Yeah, so one of the things I've been thinking about a lot lately is how the crisis of coronavirus has been exposing all of the issues that people have been dealing with for a long time already. So not only exposing, but heightening the issues As an example, I have friends who work at a Highland Hospital here in the East Bay in Alameda County in the Bay Area. And it's a public hospital, but what they're going through now is a result of decades of underfunding, decades of mismanagement, decades of understaffing. Like as an example, one of my friends, he's a service worker, and they used to have multiple people per floor, cleaning the hospital rooms, taking out the trash and stuff like that. And now it's only one person. They don't have the proper protective equipment, so it's like the chickens have really kind of come home to roost in this crisis that we're in. So the unfortunate part is that a lot of people have to deal with these issues, but I think hopefully the silver lining for us is that, like a lot of people have said already, that we're going to start to have much more deeper political conversations about what the hell is going on. Why are things like this way? And, we don't want to return back to normal. We deserve way, way better.
Thanks for having this Zoom. It was very useful last week. It actually got my ideas rolling and helped me create a flyer for my neighborhood to see if other people were willing to organize around a rent strike and things like that, or not pay your utilities, because we shouldn't have to pay for their crisis when the federal government's getting bailed out. And so I want to thank you for having these. Also wanted to speak to, someone mentioned about wanting names about management. It's interesting that you said that. I think it was Nadine, because I think there has been folks taking pictures of managers in certain sites. I specifically at Highland, when management is taking pictures of us that are workers that are using their own masks and trying to report them. So people are taking pictures back and trying to see, does anyone know this manager and things like that. So good idea. I think it's always important to not feel like you're being the victim, but you can also do the recording and investigate yourself on who is trying to get, I guess, dirt on you, even though you're just really trying to protect yourself. And I'm actually finding it very difficult. Having conversations about the greater state of the world is really easy, but it's difficult to get people to think that this is positive. I work in the ER at Kaiser Oakland, and people are just nervous that we're all going to get it. And I hear what Dipti is saying when she's saying that we should all demand to get tested. And I just kind of wonder what advice you give to all workers. Like, I mean, are we going to be getting tested every week? I mean, how much of this demand would be do you suggest? Because on a daily basis, we might get exposed, so maybe not today. I get exposed yesterday, but so anyway, thank you. My time's up.
So I'd like to join everybody in thanking the speakers. I think it's really important to be able, because of all the complexities of this, to be able to bring some solid information back and to know that there really are alternatives. I was hoping I could get a friend of mine on from Taiwan to talk, who I've been emailing with, but obviously time zones don't permit all this. But it's amazing where he is in the university. He teaches in the university, and he said in the last week, things have just really gone back to normal. They take people's temperature. They've been doing this for the last 3 weeks. Take your temperature when you come onto the campus, and this is the same in all the workplaces in this semi-industrial place area where he works. You get a sticker put on you, and then no one's going to bother you for the rest of the day. They stopped and started screening people as soon as there was a hint that anything was happening in Wuhan. They sent healthcare workers, their version of the CDC there, to investigate in Wuhan, see what was happening. They were inconclusive in their analysis, but rather than wait, they took measures to really stop the possibility of this pandemic spreading. And I think that, not to praise Taiwan, this is still a system that, doesn't really value its people for who they are, but it really is a place that they had to protect their economy. They don't have the sort of largesse that the United States has, apparently, where we are viewed as expendable. And I think what people are talking about is the idea really of who is essential in this situation. We have people who are classified as essential workers, but in fact, we see who really is essential and who really is needed in this society and who's not. And I think we have to reinforce that at work every single day. So again, thanks for all the comments that people have made.
Hi, everyone. I'm Lark. I'm in Brooklyn. Thank you to all of everybody who spoke. It's really interesting to hear what's going on in different places. I just wanted to talk a little bit about what organizing has looked like here for me in this moment. And it's been really amazing in New York to just see the layers and layers of aid structures of people just stepping up and creating forms of organization, helping out their neighbors and their communities in a million different ways that are impossible to list. And so we know that with the work that we're trying to do, organizing the building that we live in, we have tons of resources to give people. We have mutual aid where we can go through a checklist of groceries and get people registered for grocery delivery within a couple days, and just so many things like that. Right now in our building, I live in Flatbush. We're trying to currently talk to our neighbors about organizing a rent strike, and rent strike organizing is happening kind of across the city right now. All of the tenants organizations and housing organizations have been collaborating, and they issued a really long rent strike guide, helping tenants. They have all kinds of hotlines you can call. There's been tons of online teach-ins. And I was thinking of the Newark water guy talking about just how do we organize in a time where we're distancing from each other. And so I think it's been interesting in our building, just kind of doing a trial and error of seeing what's working. And we live in a building mostly Black and brown residents, a lot of longtime Flatbush residents and immigrants. So we initially sent out some flyers, didn't get much of a response. Now we've just been kind of trying to talk to people face to face coming and leaving the building. And now we are trying to arrange a phone call on Tuesday night. And one of the things we learned was, oh, wow, if we make a flyer, it has to be in 4 languages. And actually talking to people when they're entering and exiting is the best way to connect with them right now. So it's been an interesting learning process for us. But also I feel just especially since April 1st, but as every day goes on, people are very, very willing to have those conversations.
Hi, everyone. Thanks for joining this discussion. I really appreciate it. So I work at BART, the public transit system in the Bay Area. And yeah, from the very start, it was very clear that management has their regular reactive attitude. So they always wait for things to get really bad or something to go down before they actually respond. And obviously what's necessary in a situation like this is to have some preparation and a way to address and plan for what could potentially come down the line. So part of that is not enough PPE, and it's not having any situation to address the fact that, people on the front lines, for me, I'm not necessarily on the front line, or that's not how me and my coworkers look at ourselves, since we're sort of in the back shop. But we do know that we're taking enormous risks just being inside of the cars. And we know they're coming straight off of what they call mainline, where, people potentially, with the virus have been staying. So we know that most likely we're interacting with it every single day. We know that we need PPE. However, not only did we run out of it, but management has actually taken away a bunch of the Lysol and cleaning equipment from the different areas in the district because they were afraid that people were gonna just raid it. So now they wanted to exert more control over the supply, and the people who really are, who need it on a day-to-day, don't have it. So we need to find ways to get together, to find people who agree with us, not to just be quiet when people, don't believe that this is a real issue, but to find ways to get together and spark those discussions. And that's what we're trying to do. Thanks.
Hi, my name is Fumi, and I'm a healthcare worker in the East Bay in California. And one of the things I wanted to point out was one of the phone calls we got at a clinic last week, which is a patient who had gone to another healthcare organization, but lost their healthcare due to losing their job last week. And I think this is going to be our second wave, where we have so many people unemployed that are dependent on health insurance that's hooked to their employment, and they are losing their jobs and losing their healthcare insurance. And not only for COVID-19 healthcare, but they're just their everyday health insurance. This person had hypertension, was trying to call around to see anywhere they could get in, even willing to pay for their visit because they needed their medications, and they got kicked off of Kaiser. So I just wanted to point that out. One other concern I have is our elderly and assisted living. I had a patient who had a cough, and public health wanted her testing, but didn't have anybody to go in. Home health nursing wasn't willing to go in. I was ready to go in there to test her, but they said I'm high risk, so I can't go in there. And the assisted living place did not have a nurse and does not even have a thermometer. So I think we need to look for our elderly and see what we can do for them. Thank you. And thank you to all the speakers.
I know, I just think everybody, the discussion's been great. Everybody obviously is on the right track here. I mean, we got to all work together in order to deal with a situation we have at present, and then work together to try and take advantage. What I agree with everyone is a real opportunity 6 months from now to talk about why this happened and why we have an alternative that would be much better.
Okay, I just wanted to say, I know someone had a question about sort of testing of workers. I don't have a good answer. Ideally, we would get to the point where we could antibody test and see who is immune, and if that's enough to have the workers who have antibodies to go back to the workplace. And maybe it would be something like people get a flu shot every year once we have a vaccine. So I don't know. Ideally, we would have mass testing and be able to test serially. And that's not there right now, but certainly I think right now with the tests being limited at the very least, while some of the knowledge around this unfolds, to get, if you have to work in any situation and be out of the house right now, you should have a right to get a test. So that was number one. And number two, I definitely agree with Fumi about healthcare workers. We're in this crisis right now, but we know what it means for patients to lose their jobs and lose insurance. We're going to have patients coming in who haven't gotten their insulin in months. We're going to have patients coming in who haven't had their meds, haven't had care. And that's just going to be another wave of crisis that comes out of this crisis. So I totally agree that that's something that's coming. And I really appreciate the opportunity to share today. Thanks to everyone.
All right. Thank you guys so much for coming tonight and participating in this discussion. And I really appreciate you two all respecting the time so that we could have a number of us speak. So we do hold these events not only to learn and share ideas, but to connect and find ways for us to all get engaged. I'm going to close tonight's town hall with some ideas of what you can do right now. So first, remember to add your information to the email list, and there should be someone posting the link in the chat box really soon. So we all need to take this time to connect with family and friends, and we can do that by holding virtual happy hours to talk about our lives and find ways to support each other. Many good ideas can come from these discussions. It's also a really good time to reconnect with friends you haven't seen in a while and former co-workers. So you can also create a neighborhood chat group and use this time to plan how to assist each other in this emergency or in future ones. You can reach out to neighbors and organize with them to assist with grocery shopping or medication pickups if they need help. We can also reach out to friends or neighbors who might be worried about making rent. create a WhatsApp group with these people and share resources and connect people to one another. If you're still working at an essential job or what your boss claims is essential, the challenges can be even greater. So we do still need to talk about maintaining safety at work, and sometimes that means helping our coworkers understand what that means. You can start by telling them about what was talked about tonight, or by sharing easy to read articles. We still need to support each other and demand a safe work environment, which includes access to protective equipment and recognition of social distancing. And these sorts of things we have to do collectively, or our efforts will be weakened. And sometimes our jobs are imperative for the safety of others, like in healthcare, but that doesn't mean that we should allow the bosses to risk our lives. We must not tolerate that. Our demands for safe working conditions need to be heard no matter where we are or what we're doing. So no one should be working who's not tested or not monitored. It's not just about our own health, it's about possibly infecting other people. And these are all demands that we can discuss with our coworkers and see who's interested in organizing around them. So if you're working from home or you're laid off, check in on your coworkers. This can be as simple as sending a text or get a bunch of coworkers together and have virtual drinks. And if you're interested in being linked to us, speak out. There's a number of ways you can participate. Keep attending these Zoom calls. We'll be having one next Saturday at the same time, and invite friends and coworkers to that next one. If you're a frontline worker or would like to share what it's been like to experience this crisis, send us an email and we'll publish this on a new column on our website. Share the resources and articles we have on our website with others, or you can send us a message. Many of the things that I talked about, a lot of us are already engaged in, so be sure to connect with us if you want to get involved. So as horrendous as crises like these are, they can also be opportunities to connect to others and to organize ourselves in ways we may not normally think about. And hopefully by the end of this crisis, we will be more connected and organized than before. So I hope to see you all at our next event in 1 week, which will be a panel of frontline workers. The information is posted on our website now. And with that, I just want to thank everyone again for attending this Zoom call, and stay safe.